Hello and welcome to Barnsley Hospital Emergency Department. To make sure that you have the best possible experience, we would like to address the questions you probably have about how soon you'll see a doctor. We'll walk you through the steps of care you will receive and introduce you to some of the members of our exceptional team of emergency care experts. A visit to the emergency department is hopefully rare for most people, so it is important to know that an ED visit is very different to a scheduled appointment at your GP surgery or a wait in line at the bank or supermarket. Emergency care is unpredictable, and we simply can't know how many people will need care and how severely ill or injured they will be. As you wait to be treated, you may notice that some people that come in after you are being seen before you. We're using a system called triage, which means that the most critically ill or seriously injured are treated first, regardless of where they fall in the queue. Even patients who come in by ambulance may go through the triage process. We know it's frustrating to wait, but most people are far less stressed and anxious about it once they understand why it happens. On occasions, there are long wait times, even though the waiting room can appear relatively empty. The reason for this is that we have a number of areas in the emergency department which are not visible to you in the waiting area. These areas include resuscitation. This is where the most severely ill and injured patients are treated. Paediatrics, an area for patients under the age of 17. Our minor injuries service, which is run by emergency nurse practitioners. Majors, the main area of the department where a large range of conditions are seen and treated. And we also have our clinical decisions unit. This is our emergency department ward area, where patients go that require further observation prior to a decision on whether they can be discharged or admitted. When you are called to be assessed, we will take your vital signs, do a quick examination, and may request some testing be started. You may receive medication to help manage your symptoms, such as for sickness or pain. We will also ask you a series of standard questions. Some you may already have answered when you registered with our reception team. Others are standard questions we have to ask everyone. We do this for your safety and to ensure complete accuracy. In addition to this, here in the emergency department we consider safeguarding both children and adults to be a priority. As part of our triage, or later on in the process, we may ask you questions about your safety at home or in general. Please do not be offended by these questions. If we haven't asked about your safety, but you wish to tell us something, please do not hesitate, as we are here to listen to your concerns. After this, a number of things can happen depending on the severity of your emergency and the volume of patients we are seeing. You may be taken to a room in the main emergency department for a full examination and treatment. We may send you to another area of the hospital for an X-ray, ultrasound, CT scan or other test. Or we may ask you to take a seat back in the waiting room. Once you've been assessed by the doctor or nurse practitioner, you can rest assured that your treatment plan is in motion, regardless of your physical location. If your symptoms worsen, please let a member of our team know so that we can address your concerns immediately. Our team will efficiently keep your plan of care progressing no matter where you are in the emergency department. Even if you are sitting in the waiting room, blood work is being processed, imaging performed, and calls to specialist teams will be happening on your behalf. Once you're taken to a treatment room, you'll be able to meet more members of your healthcare team, including a registered nurse and an emergency medicine practitioner. We know you've had an opportunity to see quite a few people since you've been here. We recognise this can be rather confusing, especially when you don't feel well. But please be assured that this is necessary for your care. We will endeavour to keep you updated and informed every step of the way. Once you are in our treatment area, we will be doing a full history and physical examination on you. We're likely to ask you many questions you've already answered. Please remember our primary goal is to care for your needs and keep you as safe as possible. The best way we can do this is to be as detailed as we can with your health problem. After this, we will discuss any additional testing or test results. There may be a wait before we receive these back, so please be sure to let us know if anything changes or you need anything during your stay. Once all your tests are complete, we will be back in to discuss the results and next steps in your treatment plan. Be sure to ask questions if you have any. doctor caring for you may approve your discharge so that you can go home, or they may admit you to the hospital for further treatment. If you're discharged, we'll give you detailed instructions for any follow-up care needed. Please ask us if you have any questions about these instructions. If you require admission to the hospital, you'll be kept in the emergency department until we have the most appropriate bed in the hospital for your care. Thank you for visiting Barnsley Hospital Emergency Department. We are working very hard to deliver the highest level of care to each and every patient and really welcome your feedback.